Hello, my name's Michaela Miller, and today I will be doing a case study on Jamie and doing a case management plan. With that, Jamie is a 40-year-old Caucasian female seeking help after leaving an 18-year abusive relationship, needing a new home and stability for her two kids, building personal, emotional, spiritual, and mental health with her concerns of personal challenges. Her current situation has identified a family dynamic. The assessment aspect, she would be needing to build a stable house after leaving an abusive relationship. She's identified that her current situation is a family dynamics of abuse, feeling her father's abandonment, remarriage after a lasting impact on her. And she has done it again, in her view, with her now ex-husband. And then there's concerns of her physical, mental, and emotional health and spiritual connection, in which it has these different things occurring is leading to intense feelings of depression, anxiety, anger, frustration, fear, shame, and she is lashing out towards her kids, more so towards her oldest. The first goal in which we're going to discuss is establishing the housing environment and a stable relationship with Jamie and her kids. Because currently she needs to move, preferably within the same community, and establishing healthy rules, expectation, and routines for Jamie and her kids, which may require assistance in budgeting for stable housing, possible domestic abuse connection, and housing assistance, and possible therapy, individual and family therapy. That is so the family stability can be established and a budget for the housing situation will assist in building and establishing that connection with her kids. In that regard, I would have Jamie connect with a financial or budget person within 2 weeks and establish a move-in date within 90 days and counseling for her and her family within 60 days. For the second goal, it would be from her anger issues and reliance on medication, to which would start with doing a trauma-informed care treatment plan with a therapist and possible group or individual therapy within her religious beliefs. This will help in building a support system around Jamie's religious preference, in healing from her anger issues and her relationship with God, and at the end would help reduce her dependency on medication. I would have this religious groups contacted and started within 30 days, and then determine the therapist contact and starting within 60 days. Some of these groups in which can be used is the Abuse Women's Aid in Crisis, which helps in domestic abuse and can assist in guiding both therapy, housing, and healing, in which Jamie is in all three categories in need, and they are able to assist in that area. There's also the local resource of biblical counseling, in which is more in the Christian worldview of counseling, which can help in group therapy and individual therapy based off her religious preferences. And then the last resource I'd have her contact is the Alaska Children's Trust, which assists anyone with adverse childhood experiences, in which Jamie has identified with her father's abandonment. After the initial contact, some of the things in which I'd be monitoring and checking in every other week for about 3 months, to which then I would progress, if able to 6 months and go from there. Specifically for goal 1, it would be measured by the security of the housing and family reconnection. For goal number 2, it would be measured by the medication reliance and her feelings of faith connectionness in which she would have established. Some of the things that need to be considered are the barriers that she may face is acceptance within the religious center of them not accepting her as a single mother. Another is the family healing and connection, which may be something in which Jamie has to do on her own and continue working on her own, as her kids not wanting to participate, and possibly having the housing budget not work for the area which she'd prefer to live in, and she would have to move to a different area, which may affect the family healing and that process. And lastly, in monitoring, I would identify that we have made great progress, and there is a possibility of relapse, and it's not something to be ashamed or felt bad about. It is part of the healing journey. We do not change overnight as people. It takes time, practice, and effort, and we are bound to slip up, and to take that as grace and a learning opportunity and not something to be ashamed about. Next would be the termination aspect, in which would not occur until Jamie has identified a stable housing, reduced her dependency on medication or non-existent, because that was one of her goals, and her reconnection with God and her kids. In doing this, she will have incorporated exercise and nutrition in her daily routine, reduced her dependency, which will enhance her physical and mental health. She would also heal from her anger issues and reconnecting with God, which she views as a vital importance to her emotional recovery and restoration to her relationship with her kids. I would do the check-ins at 6 months later after the initial monitoring stage to ensure the housing has progressed, relationship has been established for personal or family therapy, and minimal medication reliance, and her religious connection has been reestablished. Some of the referrals that may be needed for afterwards is a connection to therapists, individual or group therapy, and religious connection opportunities and different community resources regarding her religious beliefs. And also, of course, recognizing how far she's come from intake to determination aspect of meeting her goals and hitting all those things in which brought her into the agency in the first place. Some of the challenging aspects of the case plan is not being able to ask that open-ended question specifically for the planning stage. Due to Jamie should be the one in charge of creating the plan. We can make our opinions and our views of how they should go about it, but unless the client identifies how they want to do it and how they're going to do it, it is just a guessing and hoping that they will follow it. And then, of course, the termination aspect, because in terminating the relationship in which has been built between client and the case manager can be hard in saying goodbye. In which some of the things in all aspects of the case management, there needs to be some cultural and ethical views in which need to be considered, which can be done through active listening, maintaining an open mind, and maintaining competency, in which is based off the taking into consideration the person's background, where they're from, and information of their beliefs, and understanding that everyone has the right to their own beliefs, and it's not our job and not our right to judge or make an impact on that. Our job is to help them get where they want to go and where they need to be. So working with clients and maintaining a level of competency is required through the NSAW Code of Ethics, and so is maintaining active listening and an open mind. So in that collaborative aspect, it is required and needed for the client to take the lead and following their desires in establishing the SMART goals in which the client needs to follow to get to their ultimate goals. Us as case managers establishing those SMART goals without the input and information from the client, the likelihood of them completing that goal and meeting those expectations is less likely. As for the Christian worldview, in Jamie's situation, it's easier to follow due to her wanting more of a religious connection as part of her case plan. Though if someone does not have the Christian worldview or have a religious aspect wanting to be part of the case plan, the biggest aspect is treating them like they're human people and giving them the respect that they deserve in respecting their goal and their path, and treating them the way in which God and Jesus would have. It is not our responsibility or our right to judge them. We're there to support, and that is where the Christian worldview comes into play, because we are supporting them in meeting their goals. With all of that, here are some of the resources in which I have used in determining this case plan, specifically in using for the linking and connections for Jamie to use in her goals, and resources she can use. If there is any other questions, be more than free to answer and assist in that regards. Have a great day. Thank you.